Hi, everybody. My name is Losman Jimenez, and I'm the Project Director for Immigrant Justice. Thank you, Maya. And we're really excited that you're joining us. We know that you're joining us at a really critical time in history. We're all impacted by this, but as we discussed, this being a racial justice organization, the racial injustices that exist, the structural racism that exists in this world and in this country, specifically the United States, magnify the harms that are being felt by communities across the country in every state. And I also want to just acknowledge also that this is a bilingual webinar. We want to follow principles of language justice. So we want to, again, highlight Detention Watch for helping us figure out the best way to do that. And so there is a line for language justice for Spanish translation and interpretation. So if you don't know that, it's being put in a chat box. Barbara Suarez Galeano from Detention Watch Network is facilitating that. If for some reason you don't see that, let us know and we'll put in the information in the chat box, okay? So you should be able to hear this in Spanish. And just again, you know, COVID-19, it's a pandemic. And as it pertains to immigration detention, we have over almost 500 people registered for this webinar, for actually people from all over the world. We have some people from Spain listening, Mexico, from the United Kingdom, and people from all walks of life, teachers, volunteers, healthcare professionals, organizers, lay people, and civil rights advocates. So some of you may be familiar with immigration detention and some of you may not be. But for those who are not, I just want to share that in the United States, people who are immigrants, people who are not US citizens, can be incarcerated for long periods of time in inhumane conditions. Some of these places are run by ICE, the United States Citizenship and Immigration Enforcement Office, and some of them are run by the Border Patrol. The vast majority are run by ICE, and ICE has private facilities that they contract with, run by private prison companies. About 60% of those are, and the other percentage are contracts that they have with local jails, county jails, and state prisons. Allegedly, there is oversight over these places, but that doesn't always happen. People die in detention, people are abused in detention, people are sexually assaulted in detention or given rotten food in detention. So even though there's supposed to be oversight, there isn't. People die. And so this is without a pandemic. With a pandemic, you can imagine the harms are magnified. And our organization has been working on immigration conditions with Puente Human Rights Movement in Arizona, who's really been working on this issue for almost more than a decade and really been fighting for the decarceration of the state and decriminalization of migration for a long time, and also supporting a group in Pennsylvania, Juntos en Casa San Jose, on decarceration efforts there and accountability and detention. So I'm just going to show a short video from a report that we did with Puente Human Rights Movement. We created this report, and this video is a 2-minute video, and it just kind of highlights the conditions at one ICE facility in Arizona, but really they're an illustration of what immigration detention is like in vast majority of places. So I'm just going to bear with me while I just transfer this to the video. We think that Arizona is also a case study because now you're seeing it all over the country.
While ICE is expanding its facilities, Congress has received no information about additional health staff or resources.
The fact is that this situation is not sustainable.
From when you first walk in and they give you recycled dirty underwear, to getting food with maggots, to being denied medical care, to being forced to work for $1 a day.
Those are just a few of the disturbing finds Losmin Jimenez and her Washington, D.C.-based group, the Advancement Project, say they discovered while visiting the Eloy Detention Center. The details just released as part of the human cost of being confined.
Eloy is the deadliest immigration detention center in the entire country. Abel Reyes Clemente died of pneumonia that went untreated for weeks. And we're seeing that again with the story of Jose de Jesus.
The death of Jose de Jesus was ruled a suicide.
ICE is a fairly new department in our government, created to criminalize and detain us for profit.
Force Civic, a private prison company that's making money off of people, of human beings, and the less they provide for them, the more money they get. This is an inhumane system that needs to be stopped.
Yo digo, no están solos, ustedes dicen, no están solas. No están solos. No están solas. No están solos. No están solas. No están solos. No están solas.
No, that's hard to watch. So this is a report. The website is Inside Eloy. You can go to the report. I'm just going to scroll down. And the graphics in this report were prepared by the people of Puente Human Rights Movement. So they're very powerful graphics. And it goes over incarceration crisis in Arizona, the deadly conditions inside Arizona Department of Corrections facilities. This gentleman, Mr. Richard Washington, wrote a letter to the court saying, I am being killed. And he wrote it by hand. And shortly, about 6 weeks later, he died in Arizona Department of Corrections facilities. This is just one of the stories featured in this report. When we were inside Eloy, people told us that they were saying the medicine we get is dollar store medicine. So we're using the words that people shared with us. And just some of the inhumane things that we heard about, we met people who were pregnant. The food can be rancid and have worms. And people are given recycled dirty underwear. And when they're very sick, they're told just to drink water. So this report highlights a lot of the inhumane things that we saw at Eloy, but they are really, it can be in any detention center. And so if you want to watch more of this, download the report, you can go onto insideeloy.org and get more information. And at this point, we're gonna stop sharing the screen, and we're gonna turn this over to hear from directly impacted communities who are been fighting for their communities. And first, we're gonna hear from Puente Human Rights Movement in Arizona. So I'm really excited that they're able to be part of this webinar. Thank you, Puente.
Hello everyone, my name is Noemi Romero and I am with Puente. My pronouns are she, her. In 2013, I was detained during a Arpaio work raid where I was booked into Estrella jail, which is one of the county's jails. After serving my sentence, I was then transferred to the Eloy Detention Center, where I got to spend a month. During that time, I got to experience the horrific ordeal of being in a tiny cell with another person. And let me tell you that other than just being a tiny cell, it was filthy and old. I couldn't believe that I would be living there for so long. The cleaning process did so little to help. In the mornings, the guards would announce cleaning. And all that was provided to you was a mop that was being used for the 50 cells that was in the pod I was in. You were giving a spray bottle with disinfectant that had no scent at all, and it was diluted with water. For most of us in there, that was obviously not enough cleaning supplies. So what we would do was that the shampoo we would order from commissary, we would spread that on the floor with water, and that was how we would mop our rooms. Unfortunately, not for everybody, that they couldn't do that because not everybody had the sufficient funds in their commissary books. So that was the way that we thought we would get ourselves to be a little sanitized, because none of the products we were given in there were sufficient. These, they also provided, if you didn't have money on your books, they would provide you with shampoo and soap, but it was a bottle smaller than the regular travel size that we get out here. And it was very cheap soap that no matter how much water you would put in it, it wouldn't bubble up. So we would always just try to figure out a way, share the shampoo with others so that their cells could be somewhat clean. During my time there, I also got to see how people would get sick and they could be dying and the medical unit would never arrive on time. They were always delayed. Now with the COVID-19, I can't imagine how people in there are surviving and trying to stay safe when nothing in there is sanitized. Like I mentioned before, those cells are filthy and old. From testimonies of our loved ones currently detained, I have learned that if they don't ask for sanitizing supplies, nothing is given to them. No information on how to stay protected from COVID-19 is being provided to them. The only resource that they have in there is the TV. But they are scared that if the correct protocols aren't being met, they are more at risk to catch the virus. As we know, they are in crowds of more than 10, which is obviously not safe for them. Recently, an individual at La Palma Detention Center was diagnosed with the virus, and no one is taking action to keep the rest of our loved ones safe. We need action now. Our people are in fear more than ever. So I ask that you please all sign, share, and make calls to your elected officials so we can have our loved ones free.
Thank you for that, Noemi. Noemi was speaking a little bit about the immigration process and what that has taken its toll on us as people. Erica will be speaking a little bit about the experience of the criminal justice system and that unfortunate toll as well. So I'll just give her time for that as well.
So after hearing what Noemi was talking about, some of the things that she personally encountered, I'd like to just speak on the long-term issues that we've been having in Arizona as far as incarceration. Most of the men in my family have spent time in the Department of Corrections. Both of my brothers, one of my brothers suffers mental health issues, and so I got to witness the mental health medical care through him. And then my other brother, who has been in and out of prison since he was 13. So my brother right now, currently, he is finishing up a 13-year sentence. He's about 4 years to the gate. And so some things that I'd like to, since we're talking about a pandemic, some of the things I'd like to highlight that our family members are experiencing inside are overcrowding. We've got people, Arizona is so far behind in their sentencing reforms or anything like that. So we've got old timers, people who've been locked up for a long time, 25 years plus. We know about lack of food. We know about lack of medical care. And so when you add all those things up and you think about a pandemic, they don't make sense. So how do you social distance when you're incarcerated or you're in prison? And so, how do you social distance and how do you deal with a pandemic when you're incarcerated in overcrowded rooms and bays? And so some of the things that I've been noticing that have been happening through my family and loved ones, that when we talk about this pandemic, they're telling me a lot of the stories of things that they're dealing with. My brother in particular is in a bay with 50 other people. He was just moved from one prison to another. He is usually on lockdown. We talk maybe once a week, maybe a week and a half. When he calls me, Arizona gave us, our families, 2 free calls a month. And supposedly they're giving people, sanitary, soap, things that typically are considered contraband. But when I talk to my brother, there's no stories of that. He's talking about being stuffed into a room with 50 other people. And then when I ask him, like, what are the conditions like? Are there sick people around him? He'll tell me, yes, there's people coughing left and right. And I said, well, what do you do to protect yourself? He told me he built a tent with his towels. And so with what I know DOC has been doing for a long time, and what I'm seeing with the handling of the pandemic, it's just not a good scene. And so what I've been doing is connecting with other family members who are dealing with similar issues. I'm hearing, mothers concerned about their sons, their husbands, family, their wives or whatever. And so I've been connecting with other people, and it's the same story all across the board. And unfortunately, we have a governor who really doesn't care too much about our incarcerated loved ones. Like I said, we have a long history of locking people up. And so what we've done as an organization, and we have a long history of doing, we started a crisis hotline where we have family members calling in and talking about, they're my loved one, I don't know where they're at, I haven't talked to them in X amount of days. And we're basically building resources for ourselves, how to navigate this scary time. Also at the same time, which ECs will talk about in a little bit, is we started a petition to try to get our voices uplifted and try to seek real change for our loved ones. I don't know. I feel disappointed in Arizona, I guess, but I'm seeing other states releasing people. And like I said, my brother's 4 months to the gate, and it really worries me that we're in such a time of crisis and he is not getting he's not getting any help, he's not getting any sanitation. And so, I don't know, I think that this is a very important conversation, and I'm really glad that we're having it. And I think this is a time for us to push for long-term change in the state of Arizona, legislation, everything that we can do. I think this is an amazing time to take advantage, but we got to free our loved ones.
As you all can tell, I apologize. These stories are very poignant. They're our lives. They're everything that we are as people. And I would just like to echo the point. If you all would please give us a call if you hear of any abuses, any injustices. The hotline that Erica was talking about is 602-252-1283. And as well, if you all could obviously sign the petition at bit.ly/sign-now-AZ or bit.ly/decarcerate-AZ.
Thank you, Puente Human Rights Movement, for that really important conversation. At this time, we're going to turn it to ArchCity Defenders. We're going to hear from Blake Strode and then from Inez Bordeaux. Blake, if you could, thank you. Unmute your mic. Thank you.
Hi everyone. First of all, thank you so much for organizing this. Thank you, Losmin and Thomas and Advancement Project. Really glad to be part of this conversation and to hear those stories. I really appreciate folks sharing. So ArchCity Defenders, for those who may not know, we are a nonprofit, holistic civil rights firm, legal advocacy organization in the St. Louis region. And we do work across direct services, litigation, and we do quite a bit of work with organizers on the ground, really trying to build power at the grassroots to shift systems that are impacting the people we serve, which are, in this region, poor people and disproportionately Black people. And so when this crisis hit, or when it became clear that it was hitting a few weeks ago, we really began developing strategies to focus on getting as many people out of cages as quickly as possible, using some of the tools that we had available to us, and to work with others and really making clear the urgency of this issue. So there are basically 5 categories of work that I want to talk about today, and I'll do so pretty quickly. The first is that we've focused a lot of energy on drafting and organizing support around a series of letters to policymakers focused on marginalized communities. So the first example of this was a letter that we sent out on March 13th, which went to officials across the region and even across the state, that identified 6 different categories. And 3 of those really were focused on the carceral state, focused on police, courts, and jails, prisons, and other detention facilities. And under each of those headings, we had policy demands that were gathered in coalition with various community organizations and advocacy groups. And those policy demands were sent off with the signature of, at the time, 18, I believe, organizations that signed the initial letter. It then was turned into a petition that has garnered over 1,800 signatures and now has about 40 organizations across the state that have signed on. So part of what we saw early on with that original letter that became a petition was that it helped to frame the conversation in both St. Louis and across the state about what the COVID-19 crisis really means and the communities that are going to be struck the hardest by it, and especially really focused on folks who are currently locked up in cages, who have nowhere to go when this virus hits. And so that initial letter really spawned a lot of kind of breakout efforts that are continuing today. One of those was another sort of joint letter project that was targeted at the Missouri Supreme Court. And that actually consisted of 2 different groups. One was again, a sort of advocacy group that signed a letter to the Supreme Court urging them to order the release of people from jails specifically, which are under the court's purview. And the other, which I think was in some ways even more important, was an effort to organize medical and public health officials in the region and across the state. And the lead author of that letter actually was a former medical director of a jail here in St. Louis County Jail, who wrote a letter saying these jails are not safe. They cannot be safe by their very nature. The people that are within them will be susceptible when the virus strikes. There's no social distancing. There's no amount of sanitation that they can do. Don't believe you if they tell you they can. And that was signed by 16 other medical and public health professionals and has been signed on by more since, and was delivered with the advocacy letter that we delivered to the Supreme Court. So all of that was sort of an effort to frame the narrative and get a sort of aligned call to action around advocacy and organizing partners in the St. Louis region and across the state. Another category has been through litigation. As I said, we are a legal advocacy organization, and just last week, I'm sorry, that was this week, I'm losing track of time, we filed an emergency motion in our bail litigation, which we are partnered with Advancement Project as well as 2 other legal advocacy organizations, Civil Rights Corps and ICAP at Georgetown Law Center. We filed an emergency action in that case to try to get a preliminary injunction. This would actually be the second injunction, which just for those that aren't lawyers simply means an ask for the court to do something before the end of the case, to give some kind of relief before the end of the case. And the first time we got an injunction in this case, we were able to get about 120 people released from jail in a course of just 5 days. And this time when we renewed that argument, we really made explicit that the situation is even more urgent because people who are locked up in cages are much more likely to get sick. And for folks who we know that are in higher risk categories in particular, likely to get severely ill and die if they contract this disease. And so that litigation was just filed a few days ago, and we're fighting that fight to try to get what relief we can through the court. Another category is really been trying to build pressure on local officials within the system, specifically judges and prosecutors. So I talked a little bit about the letter to the Missouri Supreme Court, but we also have been doing really targeted advocacy with individual judges and prosecutors in the St. Louis region. The way that our courts are set up, we have presiding judges that have a lot of authority in both St. Louis City and St. Louis County. And we've been sending calls to action to those folks, having individual meetings with them, telling them what we want to see, and then really tracking the progress on those things. We've also done the same with prosecutors. We're part of a prosecutor accountability roundtable here that really focuses on our 2 elected prosecutors in St. Louis City and County. And we've convened a conversation with them. The 14, 15 organizations at that table have convened conversations with them, and also are releasing statements about our expectations for prosecutors, and also making sure that when folks inevitably mischaracterize the release of people from jails locally, that we're pushing back against those narratives as well. The 4th thing really is an effort to bring all of the sort of pieces I've been talking about together, and that is an advocacy hub that we put together with our organizing partner, Action St. Louis, and a local Black weekly newspaper, the St. Louis American. And this hub houses a lot of the efforts that I've been describing. So the basic idea behind it is we broke out those different calls to action that I talked about in our letter that we delivered March 13th. We broke out those 6 categories, listed out the policy demands that we had, and gave an update on which ones have been implemented, which ones have not, which ones have been partially but still need more effort and advocacy. And that's being used as an accountability mechanism so that people can go on, they can see what needs to happen, what has happened, what has not, and really use that to pressure public officials. And we provide the contact information, we list out what officials are responsible for which of the calls, and also name other advocacy efforts that are happening in those buckets. So that site just went live a couple of days ago. If you'd like to see what that looks like, it's at stlcovidhub.org. And it's just going to keep growing and developing, I think, with time as we get updates. And the last thing I'll say before I turn it over to Inez is that we've really put a lot of time into reaching out directly to people impacted by incarceration in this region. So we've both done a series of interviews essentially with folks who are incarcerated in local jails and collected those accounts. And they have told us things like, they say they're sanitizing, but they're not even providing us soap unless we pay for it. They say they have hand sanitizer, but it's sitting at the guard station and we can't get access to it. They're not screening anyone in the jail at all for higher risk factors. And so we're learning a lot about the real conditions in the jails by talking to people, and also by talking to their families who, as you can imagine, as you just were hearing, are going through tremendous trauma as they think about their loved ones on the inside. And so we've really been gathering those and are just now really kind of figuring out ways to tell those stories honestly and effectively, and make sure that people are able to raise those up in their own voices. So that's what we've been working on over the past, I guess, 2.5 weeks now, seems like more, at ArchCity. And I will, I guess, pass it to Inez to talk a little bit more through the lens of our local campaign to close the Workhouse jail.
For some reason, it looks like we lost Inez for a second. I don't know if her connection was bad. What we can do is just turn it over. Okay, Inez. Hey, Inez, we lost you for a second. Okay.
My kid is playing Fortnite and eating up all of my internet bandwidth.
Okay, sorry. Okay, we're turning it over to Inez. Real talk.
So yes, hi, my name is Inez Bordeaux. I am the manager of community collaborations at ArchCity Defenders. I'm also an organizer with the Close the Workhouse campaign. I want to start off by saying when I was listening to Nomi talk, I could have swore she was talking about the Workhouse. Like every single thing that she described is things that I experienced myself in 2016 when I was in the Workhouse. Like we could have been pod mates or something. So I know for a fact that people in the workhouse are living in these squalid conditions. I know because I was there. I spent 30 days there in 2016. The rats and the roaches and the mold and the funny smelling water and the showers that don't work and the toilets that don't flush. Like, all of these things were happening, and I saw them with my own eyes in 2016 when I was there. And so I know that people who are there right now are dealing with those same conditions. Conditions have not improved, but now they have to deal with this virus on top of it. A lot of what Nomi said about not having access to soap and hot water and hand sanitizer and things like that are real. Like, in the workhouse, if you don't have money on your commissary, if you don't have money on your books, you cannot buy soap. And you have to be there for 2 weeks and be declared indigent before a caseworker will even give you a bar of soap. And it's very much like the size of one of those little hotel room bars of soap, and that's all you have. So because they haven't changed any of the policies, because they haven't done anything to improve the facility in any real substantive way, like, I know that that's what people are dealing with. And from the very start of this campaign in 2018, we have always been on red alert about this facility. It has always been life and death. As far as this campaign is concerned, because a lot of times when you go in the workhouse, you may not come back out. I am a person that went in the workhouse and I was afraid I wasn't going to make it back out. So we've always been on high alert. It's just now we're talking about deaths at a much higher rate. Before I was a collaborator and an organizer, I worked as a nurse in the state of Missouri. So I understand firsthand how epidemics spread, how social distancing is impossible when you're inside of jail. And then that on top of my experience of knowing that they do not have access to soap. They do not have access to hot water. The people that are being detained there, it's impossible for them to be cared for properly. So not a whole lot has changed for this campaign in terms of our sense of urgency. We've always had a high sense of urgency. If it's possible to get higher than level red, like, that's where we are. And as an organizer, it's very difficult to continue, or we're learning how to continue to keep our allies and supporters and partners engaged in the work by moving everything to a digital platform, to social media. I am a very petty person. I enjoy it. One of my favorite pastimes is trolling the mayor on Twitter. Like, it's what I do for fun. So, like, we encourage people to do the same. You're at home, you have time. Like, you've got time to call the mayor. You've got time to call and add your alder. So encouraging people to, like, don't let the fact that we're in the house stop you from organizing. We can still continue to organize. We can still continue to do the work. And for those people who kind of lack, I'm not going to say motivation, but that fire is going down, I remind them why they're angry in the first place. I remind them of the conditions that people are continuing to live in. I remind them about the rats and the roaches and how now people are dealing with all of that on top of a virus. I remind them that, you know, angry gets things done. Anger is a renewable energy source. So every time you start to feel disheartened or tired or not sure if you can deal with this crap today, I just remind them to get angry and then call the mayor, because that's what I do. I get angry and I call the mayor. I get angry and I tweet the mayor. So anger can be contagious. Spite can be contagious. It's a powerful motivating tool. And as scared as we all are out here walking around free, like, people in the workhouse and jails all over the city and country are feeling what we're feeling and experiencing what we're experiencing, but at an increased heightened level. And so while we're afraid for ourselves, we really have to be afraid for them. And then we get angry and then we do the work. So that's where we are.
Thank you so much, Inez. And now we're going to turn it over to Jacinto Gonzales. She's field director of Mijente and also senior organizer. And we're just really excited to have her as part of this conversation also. Thank you, Jacinto.
Thank you so much for having me, Losmin, and for putting together this conversation. Really excited to be on this webinar with everyone who's here, and wanted to just really thank everybody for the hard work that it's been taking in the last couple of weeks. I know that we are in a time of incredible crisis, and it's enough to have to figure out how to survive, but figuring out how to take on these new stages of fight has been really, really difficult. So lots of love and respect to everyone who's been part of the you know, as folks have been describing, our incarceration system in the United States has already been in a place of tremendous crisis and putting people's health and lives on the line. This is a crisis that a lot of communities have known about, but a lot of folks have decided to look the other way, and especially politicians have decided to not only allow it to continue, but actually have tried to create ways for it to expand. And so it's been kind of exciting and a little bit of an interesting moment to be in this crisis moment, where we know that in moments of crisis and moments of chaos, we're able to move ideas that in regular times might seem crazy or far-fetched, right? In moments of crisis, we sometimes say, oh, actually, maybe let's take that on. If you had asked me, 6 months ago, would Donald Trump be talking about any semblance of universal income, whether it's enough or not, we would have said, absolutely not, right? But in this political condition, all of a sudden these things can shift, and that can be the reality that we're in. And so I think for a lot of us, we've been trying to figure out, how do we use this moment of crisis to push ideas that we've been organizing around for a while, right? To talk about not needing to have the police be conducting tons of arrests, not needing to have so many people be incarcerated or in detention. Talk about what is the role of government in our communities, and how does government keep us safe and keep us healthy and keep us together as communities. So we kind of have this moment where we have the opportunity to move big ideas, but we also have to kind of go in there with surgical precision to be able to figure out where are the places where we can organize and lever power to get our people out, right? So we kind of have this dual thing where we're like fighting for the broad demands, fighting for big ideas, but then having to go in and kind of kick ass in particular ways and in particular fights to actually be able to get our people out. So I just wanted to talk about some of the ways that we have to hold on to the big ideas. What are ways that we can go in and give like some good hits, but then also just some pitfalls or some things to be looking out for that can kind of get in our way as we're trying to figure out how to decarcerate in this moment. So the first thing is, I think, as much as we should be thinking about making sure to get people out of incarceration, we also have to be thinking about how we can, in this moment, put pressure on police departments to be putting less people in, right? These are the moments where all of a sudden police departments realize they don't want to be picking up people for municipal offenses, for traffic citations, for a lot of things that we can be pushing for really aggressively and saying there's no need to be arresting people in this moment, and the police should back down. And so we've been seeing drops in arrests in a lot of cities in ways that are really exciting. And I think we have to both be able to continue to push for that, but also preserve that, that mindset when folks are starting to talk about how to enforce curfews or make sure that people are, social distancing, and what is the role of the police in intervening there. We're seeing, of course, they're going into poor communities, they're attacking young people. So we have to be able to push back and say, we really, really need to make sure that the police is not in our communities in this moment because they're making things worse, not better. And we have to do that in a way that we can hold on to that power. So after we come out of this crisis, we can continue to make those arguments and show why the arrest rates shouldn't go back up, right? We can have a way of kind of keeping them low. And that's the same thing for ICE, right? There's been kind of a push in this moment to stop ICE raids. We know that they're still going into communities, but we have seen even them say that they're gonna be pushing back. And so we see kind of these demands to be able to decarcerate really connected to stopping enforcement and stopping policing. And so when we talk about getting people out, folks have been talking about some really amazing campaigns that have been fighting at the state and local level. This is a time where everyone has to get hit, right? It has to be the mayor, it has to be state officials, it has to be city council. So it's been really exciting to see groups like Puente, to see groups like the Detention Watch Network create whole action, days or weeks where every day people have someone to hit, because it is about creating an echo chamber as broad as we can, that what we need to do in this moment is to get people out. But of course, with immigration detention, we have an interesting difficulty, which is that we have the federal government as the one that is the decision maker in terms of being able to release people from immigration detention. And as you guys can imagine, in these moments, ICE is not exactly receptive or communicative or trying to release people. And so given that we don't have a target that is necessarily movable, what does that mean in terms of how to push? And I do want to shout out the work of the Detention Watch Network with the Free Them All campaign. They really have been doing amazing work getting people out, giving people concrete ways to plug in. And folks should check out all of those materials. And be able to continue to support that. But I think we can continue to support, continue to put pressure at the federal level, but we have sheriffs, we have police departments, we have local targets that are working with ICE, that in this moment we can demand to make sure that that collaboration stops so that less people are being put into immigration detention. So there is both a federal demand and also state and local demands in terms of who to be putting pressure on. But the thing that we should also be kind of tracking is, as people inside of detention centers are feeling more and more vulnerable, are feeling more and more at risk, and are starting to see cases, folks are panicking and folks are resorting to hunger strikes as a way of getting their voices heard, making their demands, making sure to put pressure on the system. And so organizers are trying to figure out how to support people in those hunger strikes, and how to continue to also use that as a way of amplifying the demand to free them all. So I just wanted to highlight this because doing rapid response support to hunger strikes with folks that are in very remote detention centers, usually 2 or 3 hours away from cities, being put on lockdown, so don't have access to phones, don't have access to legal visits, has been incredibly difficult and taxing, but something that I think immigrant rights organizers are going to have to, we're going to be getting the calls in the next couple of weeks, so we're going to one of the kind of pending questions for us is how do we continue to respond to these building hunger strikes? But I wanted to just also highlight that because this is a moment that requires surgical precision in terms of how we get out, this is also a moment where we can experiment about how to do harm reduction and get individual people out. We're seeing ICE release groups of asylum seekers. We're seeing ICE release folks that are HIV positive. We're seeing ICE release folks in very specific circumstances. But if no one is asking for them to be released, ICE is not going to take it upon themselves to let them go. And so there also has to kind of be a constant demand on ICE to be releasing particular folks or different cases, and using old-time organizing strategies that we used when prosecutorial discretion was a thing, bringing those back and working on particular cases to get folks out. And part of that is also bonding people out. We know that in this moment, there are people who are locked up who have bond, especially in immigration context, because many people have to pay the full amount. It's usually very inaccessible. But there are folks that are doing really amazing work with community bond funds, with different groups that are raising money and just paying to get people out. The more folks that can do that right now, the better. We are actually able to get people out and save lives. So this is also a moment for bond funds to, one, there's a lot of folks at home that want to figure out a way to support, want a way to plug in. This is a way for them to make a donation that can actually be directly linked to getting someone out. And it's a time for folks to just be able to kind of amass resources in a way that can really be, can just really lend a lot of support. So those are just some of the things that we're kind of tracking in all of this. I think one of the pitfalls to kind of look out for is, as we're saying that everyone should be released, and then folks are going after particular subsections, it's important to make sure that this is not undercutting the demands of other groups or saying that some people are deserving of release and some people are not. right? One of the things that we see that's really difficult sometimes, and we've seen in the immigrant rights movement forever, right? Where it's like the good immigrants deserve to be legalized and the bad immigrants that have any sort of criminal record should be deported. It's the same thing in terms of release. There's a lot of things about, well, if you're old, you should be released, or if you're sick. And obviously we want to make the surgical interventions to get people out, but we want to make sure that our general bold messaging is actually about releasing everyone so that we're not actually reinforcing narratives that are further criminalizing certain sections of our communities. And for us at Mijente, we've particularly been working on the Department of Justice to release people who are being prosecuted for immigration-related crimes. We know that of federal inmates are Black and Latinx. At least 50% of federal prosecutions are for immigration-related offenses. Can folks still hear me?
Yes, they can hear you, Jacinta.
Okay, sorry, I'm getting cut off. But I was just saying that we've particularly been working on the cases of folks that are in federal detention. We know that a large percentage of federal folks that are federally prosecuted are Black and Latinx, and at least 50% of federal prosecutions are for immigration-related offenses. So this has been a very important place where not a lot of folks have been pushing, and so we organized a sign-on letter to the Department of Justice, to Attorney General Barr, demanding the release of everyone for those types of prosecutions, ending those types of prosecutions, and being able to re-sentence folks that have already been in. We've seen that the response from the Department of Justice has actually been the opposite, and they've tried to use the First Step Act as a way of monitoring how they're releasing people, and many times they're using what is called the pattern risk assessment tool, which is of course prioritizing the release of white folks that are behind bars and not other communities. And so we just wanted to raise this as a second kind of trap of what we've been seeing with decarceration work, is that many times folks are saying, okay, if we don't use cash as a way of releasing people, if we're not going to hold people, we should use risk assessments or algorithms to be able to predict who should be released or who shouldn't. But we know that these are just, ways of systematizing institutionalized racism and other types of discrimination that have existed in the criminal justice system for some time. So they're just, replacing the same systems that we've seen and replicating the same forms of difference that we're seeing. And then the second thing that we're seeing is that a lot of folks are being released with ankle shackles, and that a lot of systems are trying to pretend that ankle shackles or electronic monitors or home incarceration systems are better alternatives to incarceration. And obviously, when we're thinking about harm reduction on individual cases, folks might have to make very hard decisions. But it is very important for us as advocates to not be encouraging that this is used as a way to replace incarceration, because we know that at the end of the day, it's just expanding the same system. And that once this is over, we're gonna have to deal with both the ankle shackles and with the brick and mortar prisons. And so as we're advocating for a reduction in the system, we have to be able to say that on a whole level. And so far we're seeing that even though some of these tools, right, would be at risk assessments or ankle shackles are being used to undercut, we are still seeing, for example, that Operation Streamline has been cut in several courts. We've been able to reduce the amount of people who are being prosecuted. And we have been able to get a few folks out on bond, which is extremely rare for federal prosecutions of immigrants. So it's been kind of also exciting to see some of these experiments come to fruition. So it's just kind of a time where we have to push on all of the levels. So I think that's about it for now. Really excited to hear from other folks on the call and for answering questions. Thank you.
Thank you, Jacinta. And I was going to say, we have a slide at the end, resources, and there's links to the Detention Watch listserv, Detention Watch Network toolkit, a report that they did, an outstanding report in such a short time. Today, actually, this week is the week of action at Detention Watch, and today is day 4, so we're really excited to be part of that too. And there will be a link to the letter that Jacinta mentioned that was sent to DOJ where they stopped prosecuting people for illegal entry or illegal reentry in Arizona and New Mexico. At this time, we're turning it over to Thomas Harvey, our Justice Project Director, who's going to share about the national perspective and also think of, finish telling us about how so we can dream big in this moment. Thank you, Thomas.
Hi, thanks everybody for joining. I really appreciate Losman putting this together and the Detention Watch Network for all the support and for all the panelists who are joining. I just wanted to start, I'm going to share my screen, got a couple of PowerPoints. I want to start talking about the situation we found ourselves in prior to the COVID-19 outbreak so that we understand what we're talking about, generally speaking here. Let's get that. So just so everybody can see that, we've got, this is a pie chart that demonstrates that we have 7 million people under control of the United States legal system. 3.6 million people are on probation, 3 million people locked up right now, 840,000 people on parole. And we've got about 670,000 people in this country who are languishing in local jails, most of whom have never been convicted of a crime. They're there essentially because they cannot afford a cash payment to buy their freedom. And many of the campaigns that we're working with, including Close the Workhouse and Free the Block, Close the Workhouse in St. Louis and Free the Block in Miami, have got a call to end cash bail and really address the concerns about people who are in local jails. I think one of the things that Jacinto was raising is that COVID-19 is showing us how all of the things that we've wanted, all the demands we've had, all the asks we've had in the past that we've been told repeatedly can't happen are possible now. And I think that this is a really good way of us, really good moment for us to realize that the law and the regulations and the restrictions that we've been fighting against are really just a fiction that can be changed at any time if the people in power want to change them. You've got Stanislaus County that's imposing a moratorium on evictions during the coronavirus outbreak. In Los Angeles, there's an eviction ban. In Colorado, they're suspending water shutoffs because of the coronavirus. In New Jersey, they're ordering water providers to suspend shutoffs during COVID-19. These are demands that people have been making for decades to take into consideration the income inequality in this country and not to turn off vital resources for people. Because of COVID-19, these demands that organizers and activists have been making are being followed through on. In California, Ohio, and Illinois, hundreds of people locked up inside are being released early because of COVID-19. This is in Tennessee. It's not just happening in California and New York, it's happening all across the country. New York is releasing 1,100 people on parole violations. California is releasing 3,500 people. The Philadelphia police are changing their entire arrest procedures amid the outbreak. In Texas, sheriffs are responding to COVID-19 by not arresting people. This is something that all of our organizing partners have been demanding for a very long time. And we're doing it right now. As Jacinta said during her presentation, this is a time to dream big. They're showing us the things that can be done during this coronavirus crisis. Even prosecutors are urging to reduce detention populations. And it's showing that the crime rates have gone down while they're releasing people, while they're changing their arrest procedures. The crime rates have gone down so far. So for those of us who are abolitionists, this is exactly what we've been asking for and proof that what we've been asking for is the right thing. One of the tools that we've been using at Advancement Project and that people have been using across the country is litigation, as Blake mentioned earlier. In Chicago, there's a mass habeas class action filed to release people from the jails who are at risk for COVID-19. There's the lawsuit from St. Louis that we filed a renewed motion on our lawsuit on Monday, apologize. In DC, there's a class action filed against the local jails to try to get people out of the jails. And then in Miami, groups of people have done something similar to what ArchCity Defenders did and Close the Workhouse did, gathering legal experts, healthcare professionals, and local activists to detail all the ways that officials can decrease the jail population and get people free. Because of all the reasons that we've discussed, it's impossible to do social distancing in a jail. It's impossible to believe that people are going to be provided adequate cleaning supplies. So all the things that the CDC is telling us we have to have are impossible to imagine that any jail in this country can adequately provide. In fact, in some recent investigations, health professionals have been saying that it's not 6 feet that's needed, 6 feet of separation that's needed in the jail environment, it's 15 feet. And so when you've got people sleeping head to toe and sleeping on bunk beds 2 feet apart, living in congregate environments, it's just impossible for them to even take the most basic precautions to protect themselves against the COVID-19 outbreak. I have 1 or 2 more slides, but this is one of the things that I think we all have to be really taking very seriously and communicating to the general public, because this is what we're talking about. This is the opening paragraph of a lawsuit filed in Massachusetts. In the 30 minutes it takes to read this brief, roughly 377 people in America will be diagnosed with COVID-19. Perhaps 9 previously infected people will die from it. The United States now leads the world in COVID-19 cases. These are the stakes. People are going to die, and they're going to die more in the jails and prisons in our country and the detention centers in our country because they don't have adequate health care on a good day. And this is the last place in the world that our local elected officials are going to seek to take care of people. And it's really up to us and the people on the call and the people in our networks to make this clear. Advancement Project has created a website that can get folks involved. You can go to freeandsafenow.org and you can find the calls to action for our organizing partners in Detroit, in East Baton Rouge, in Miami, and in St. Louis. You can get involved and see their campaigns, their petitions, all of their contact information, and find ways to directly connect with them as you're trying to find ways to get involved and try to keep people safe in prisons and jails and get people out as soon as possible. And with that, I will turn it over to Lawrence to talk about the work that's going on with the Bail Project. Thank you very much.
Thank you, Thomas, for that. First and foremost, I want to say that it's an honor to be here to have this discussion with everyone. So thank you for this opportunity. And I would like to state that the Bail Project is not the solution for community members for leaving the carceral system. However, we could offer some options and mention what has worked so far in the efforts that we have made. And I would like to say that although we are not the solution, we do play an intricate part. We act as a bridge. We have discovered that creating solutions entails maximizing relationships with local stakeholders. And that may include some individuals that may have philosophical differences. Some of our sites in different jurisdictions have partnered up with local stakeholders to refer community members to organizations that have been released. And some of the services, but not limited to, are shelters for community members that are faced with unstable housing. And like one of our jurisdictions, because for those who aren't familiar with the Bail Project, we are a national nonprofit organization, and we have a revolving bail fund that we use to pay bail for those who can't afford it, to be able to restore families, because we don't want to see people locked in cages. I believe like Jacinto had mentioned that, and also Thomas, that people are incarcerated and they haven't been charged, but they're just sitting there because they can't afford to pay bail. And so we want to be able to kind of help mitigate that situation, to be able to allow them to fight their case from the outside rather than being in the cage. And one of the things Jacinto had mentioned was that with harm reduction, and that's another service that we have found to be key to maximize relationships with, which are substance use disorder treatment agencies, because we know that for those who are being released, that some of them may be faced with challenges of drug addiction or alcohol addiction or addiction of some sort. And they may need some assistance to be able to get through that process rather than just stopping cold turkey, as one would say. And so we want to make sure that we keep in mind like that harm reduction approach, and that would be advantageous for our community members that are being released from these cages. And also mental health services. We find it to be very important that many of our community members, are challenged with or confronted with issues such as trauma, I think which many people can relate to. And so it's just important to, as people being released, to be able to have these services and do these warm handoffs to individuals. So one, that they know that they can receive the help that they need and they can get the love, because, that's truly where the passion or the compassion and the love is within the community. In the Bell Project, we believe that the community should have the power and not the jail system. And some specific examples of solutions that have, we've implemented or not implemented, that we've exercised even in Phoenix, that, the team out there has done some phenomenal work. And we work with organizations such as Crossroads that provide housing, Community Bridges that provide substance use disorder treatment and mental health services, to be able to help the community members to be able to become acclimated, to the community again and be able to get that support, because we believe in release with support. And to me, I believe that's the solution to releasing people, is making sure that they have the support that they need to be successful. Additional services that we also offer too is transportation. That is a direct service that the Bell Project offers. And we provide Lyft rides, and even we offer bus tokens for people to get to and from court, as well as other appointments they may have, whether it's for job readiness programs and things of that nature. And also things that legal support can assist with during this time as well, is being able to combat, or I say push back on the system in terms of bench warrants that may be issued or failure to appear notices that community members may receive during this time, because that, this is a very challenging time globally, with this pandemic. And so I think that that's something that, community members being released from the system shouldn't have to worry about, because, and I think that from a legal standpoint, that's assistance that we can provide to be able to be in communication with the courts, to let them know that, that's not something that we should be emphasizing or focusing on, probation revocations or, people failure to appear, because we don't want to put people at risk going to court, because unfortunately throughout this nation, some courts are still, they're acting as if this pandemic isn't going on. And so I would like to say also that TBP believes wholeheartedly about a holistic approach. We believe, as I mentioned before, that the power is truly, we believe the power should be within a community. And I remember growing up that I would hear elders say that it takes a village to raise a child. And I wholeheartedly believe that, that a proverb applies to community members of all ages. And to me, I believe this approach, or that proverb, is mutual aid and holistic approach that can be taken at this particular time. And that's what I'm appreciating about the energy, right now, that so many people coming together to work together, for one common goal, which is to be able to kind of help people get back to the community, safe and sound, and to be supported as best as possible, because we know that they're not being supported, in the current situation right now. So I would like to just kind of touch on some key points that I mentioned earlier, that, solutions that I believe that are critical or that are important that we've seen to work in different jurisdictions throughout the Bell Project, is that ensuring that, one, that we have partnerships, with local stakeholders, for housing, for substance use treatment, for, I would say, transportation, making sure where legal assistance can be provided to ensure that, we all come together to be able to figure out how can we be one driving force to put pressure on the jail system and the court system, for that matter, to be able to hold back on issuing these notices or trying to re-incarcerate someone because of warrants and things of that nature. So, those are some of the things that I just wanted to offer, and thanks again for this opportunity to share. And I'd like to pass it on to the next speaker.
Thank you, Lawrence. Really, that was great. At this time, we're going to just have a call to action from each of the different groups that we highlighted during this webinar. Then we're just going to talk briefly about some of the resources. We're going to point you to those resources. But before we go to the call to action, I wanted just to highlight again, Barbara Suarez Galeano from Detention Watch is on, and we're going to highlight the report and the toolkit that they did. But Barbara, I don't know if you just wanted to say something really quickly before we do the call to action.
I think I'm fine. I feel like what Jacinta shared and what other folks have shared it very much encapsulates what we're trying to do right now. And just reminding folks that today we're in the middle of like the day of action where we're trying to support folks who are coming at this from the decarcerate side of things. And the webinar that we'll be having on Saturday, which will be kind of like a rundown of how the week went and hearing from other folks, particularly La Resistencia, Grassroots Leadership, and the California Immigrant Youth Justice Alliance, about how the work is looking like on the ground and reflections on like how the current targets we have been movable or not movable, and how we could better prepare to welcome folks into the community. Because when we're making calls for mass release, we have to think about how we're coordinating the welcoming of our people who are coming home. But thank you so much. And yeah, we've shared those resources on the chat box as well.
Thank you so much, Barbara. Thank you. So at this point, I'm just going to turn to Puente and their call to action, and I'm going to try to share their screen, share my screen at the same time so you can see their petition. So you can see people from Puente. Say hi.
Hi, everyone. Again, we can't thank everyone enough for the panelists and the attendees for coming and having a conversation with us during very difficult times about things that most people don't want to talk about. It's not an easy conversation when we talk about our family members that have been literally isolated and put away from all of society so that we don't have to recognize them or think about them. So I can't thank you all enough for really getting involved and recognizing that they're still our loved ones and are very necessary to us as an entire society. Again, I ask that everyone on this call, if you haven't already, to please sign and sign our petition at bit.signnowaz or bit.ly/decarcerateaz. Or call our state representatives, call Doug Ducey, call Director Shin, call Penzone, call the Director Field Officer Lusano. Basically call everyone that you can think of, Juvenile Director Jeff Hood as well. We are actively trying to call our representatives to demand everything that we need as people. We demand that our people be released. We demand that they get health and sanitary conditions in prison while they're there. Obviously, none of that, as we've gone over this last hour, is something that can actually be done in prison. So the only reasonable and equitable way to ensure our safety as an entire society is to make sure that we decarcerate our people. And as well, if you need anything at all in terms of resources, here in Arizona, Puente has put together a robust resource list, both in English and Spanish. It's there on the screen if anyone needs to review it, or if you know of anything that we need to update or be on top of, please let us know at puenteaz.org. We look forward to having our loved ones come home, and we can't thank you all enough for being involved and hearing us today.
Thank you, Isis. At this time, I'm going to turn it over to Inez. Inez, what is your call to action?
Because I would love to tell you guys to call our mayor and call our older people, but that won't make a difference. So, because it's such a local issue, but what you can do is lift us up, shout us out when you can, continue to help us get the national media attention that we need. That helps us to continue to put pressure on our elected officials. If you know people who live in St. Louis or the surrounding areas, do ask them to call their mayor and their older person. Also to email us at closetheworkhouse@gmail.com if they're interested in getting involved in the work. And then boost us on social media. When you see our post, like if you guys could give us that extra boost, especially any tweets that you see from Close the Workhouse that are targeting the mayor or a specific alderperson, that would be incredibly helpful.
Thank you. Jacinta, what are Mijente's demands?
I mean, we're continuing the demands around ending immigration enforcement, releasing everyone from immigration detention, and obviously everyone who's being federally prosecuted for immigration-related offenses. But I just wanted to lift up in terms of just things that folks can do. Call your local elected official about something once a week. It doesn't matter, just for the next. This is our mission in terms of if we have the safety and the protection of having a home that we can be able to be safe and healthy in. Let's make sure we're calling our elected officials. Please donate to your local bail fund. Try to get someone out. The National Bail Fund Network has a collection of, is an organizing a lot of local bail funds that can really help with all of this. So please support that. And again, just supporting Detention Watch Network's week of action and making sure to get all of those calls out so that we can both be advocating for people's release and supporting people on hunger strike.
Thank you so much, everybody. Thank you so much, everybody. So at this time, we are at the question and answer. We're at 4:15, so we're doing good. Again, I'm gonna try to cut and paste the links into the chat box, and we're also going to send those resources via PowerPoint. So, you know, we're gonna be posting this webinar is being recorded, and it will be on our website. But at this time, I'm just going to show you the resources that we do have before we go to question and answer. I'm going to share my screen for a second. Bear with me. So these are some resources that we have. The toolkit, hold on. Just want to make sure, share screen. We wanted to raise the awareness about this toolkit that Detention Watch did, and there's links there, and we can cut and paste the links, and I believe Barbara did that. There's also a report that came out very recently, as in last week, on COVID-19 and detention. We have a link to the letter that Mijente sent to the Department of Justice ending the Operation Streamline illegal entry in Arizona and in New Mexico. There's a link to the petition. We also at Advancement Project, so I just want to highlight again, so our organization works in the movement lawyering space in immigrant rights, education, voting rights, and immigrant justice, and ending, abolishing prisons in the private prison industrial complex. We created an advocacy letter template that you could send to your local ICE field office and Department of Correction. We actually did that in collaboration with Puente Human Rights Movement and with Juntos in Casa San Jose in Pennsylvania. So what we did is we created a template so that you can do it. You also support advocates on the ground, and you can take that letter and use it as a template. Obviously you can edit as you see fit, but it's a resource for you. So I just want to highlight, those are some of the tools we're going to be, one of the tools we created, Advancement Project, but also other tools that are out there. The Free Them All toolkit is an amazing toolkit, and it's live, and it is just full of resources for folks working on this issue in the immigration detention context. And also Advancement Project has a website that Thomas and his team put together, and freeandsafe.org. At this time, we're going to stop sharing the screen. We will be sending that presentation, and we're going to take some questions. So one of the questions that has come in is a question about narrative and demands. And one of the questions was in this asking for everyone to be released, what would you say to critics who say, well, there's so many threats to public safety, we can't do that? How do you, as advocates, as organizers, what would you recommend are some good responses to officials that are asking these questions, but also that, you know, are not throwing anybody under the bus. Does anybody from this group want to take that first stab? Isis?
Yes, thank you so much.
Okay.
I completely understand people's narratives and the ideas that we have in which we like to make all of us be the worst of ourselves. Realistically, when we're talking about our people behind bars, regardless of what they might be, we're talking about something that happened in their worst possible moment. And we're judging our people on that for the rest of their lives. What we're advocating for is not just a wiping of hands, move on. Realistically, we have incarcerated more people than anyone else in the world. And we as a nation have a very retributive type of idea when we talk about pains and harms caused against us. We aren't advocating for simply any type of release without measures to ensure that our people are taken care of. What that means is a holistic structure that helps from the very beginning of whether, you know, whatever issue that caused you to get incarcerated, to making sure that your issues are taken care of, right? So if we're talking about homelessness, addiction, mental illness, domestic violence, there are reasons why we have gotten to a point where our nation incarcerates the most people in the world. And we need to be able to address that. So the whole point that I'm trying to say is that we aren't just trying to let out people because of the fact that we don't care for the consequences of what happens to our community. We are trying to make sure that we make our people more holistically better and make sure that they can be back in our society so that they don't harm themselves or anyone else again. But that's not an easy conversation, and it's something that you're going to be able to have with like some type of soundbite. It's very easy to just throw away our people. And that's not what we're trying to do. We're not trying to let them die by some pandemic. We're not trying to let them go by closed doors. We care for them, and we want to figure out what that solution will be for each individual person in the long run. With that, I also want to let Erica speak on it.
Hi. So I've already been asked this quite a bit, so I've thought about it for a while. Being somebody that that I've got a loved one incarcerated, I watched his struggle as a young person, being kicked out of school. And through him, I met other people, other men that have, I got to learn their struggle basically. And then for a while, I started to volunteer in a women's prison right here in Phoenix. And I got to meet a lot of people, some of them with violent crimes, some of the crimes were all over the place. But I got to learn them. And like I said, Arizona has long sentencing. So basically what I'm trying to say is like a very complex issue. We've been locking people up for a long time. We have people who have been in there for over 25 years plus who have committed a crime when they were 14 or 15. We're still holding those people in. When I was volunteering in a women's prison, there was a big yard that was dedicated to people with long sentences, but for drug addiction. Like where in the community do we have resources that deal with those issues? We don't have them. So when someone asks me, are you trying to let criminals out of jail? It's like, no, there's a really complex conversation that needs to be had about long-term issues that we've been having for a long time. Most of the women that I met inside Perryville State Prison all come from poverty, abuse, sexual violence, all of that. And so when we talk about, freeing people and, the cycles of abuse and trauma that we've been experiencing for a long time, we need to deal with those root issues. But yeah, we need to come up with solutions to a lot of the war on the poor that we've been experiencing for a long time. And so when we're ready to deal with those roots, then I believe that there'll be true change.
Thank you for that. Does anyone else from this panel want to answer that, or do you want to move on to the next question?
Listen, I would just like to add to or echo off of what was already being said. I also think with advocating for release, that entails not only people who have been convicted, but people who haven't been charged with anything and they're just sitting in there. And I had come across some information that shows that people who even in Rikers, they're 9 times, people who in Rikers Island, they're 9 times more likely to get this virus than the worst part of Italy right now. So I feel like people who are incarcerated now are really at risk of even more violence. And I believe that people will probably be in a safer place in a community where they can get the love and the compassion, opposed to being in the cages where they are now.
Thank you so much.
Can I add one quick thing? Just, first of all, I appreciate the question because I think it's a really important question in this moment and presents a lot of challenges for those of us that are trying to envision a different kind of system, different kind of world. But on one level, I think this counter that gets presented of like, well, what about the public safety concerns? What about this category of bad people that are going to present a danger to us all? It's a red herring in part because it's not as if they've let out everyone that they think doesn't fall into that category even. I mean, we could very well get to a point where we really are only talking about the folks who are being left in cages being the ones that these other people think can't possibly be released without presenting a danger. But it's not as if that's where we are either. So when we say let everyone out, and they say, but there are some that we don't want let out, we haven't even gotten to the point where we're only talking about those people. So we just have to keep pushing and pushing and pushing because that's obviously what it takes. And the other thing that we've started to hear here, and this is even among some of our supposed allies, is, well, there aren't that many supports for people on the outside, and there aren't enough shelters and not enough, extra beds, and maybe it's better for people on the inside. And, what we have sort of patiently tried to walk people through in those moments is you're right to name that we don't have enough supports in place for people. The solution to that is put more resources and time into more supports for people. The solution is not to keep them in death traps in immigration detention facilities and jails and prisons and juvenile detention. And so I think it's just a matter of really trying to shift that frame whenever possible.
Thank you so much, Blake. We have another question, and this question is about the role of bond funds in this moment. What is the role of a bond fund during this crisis? Who would like to take that question? We have 4 minutes left.
I mean, I'll just jump in quick and just say that I think that this is one of the times where you really can start to see the connection between member defense, between being able to support people in their material needs as they're confronting the system and being able to make kind of a case or be able to push for broader policy demands. So I think it's really exciting to see, again, local bond funds or other folks being able to do the work to both be able to raise money to get people out. And now is a time to be able to do that as much as we can, but to also be able to use that as an opportunity to organize with people to both support them in their everyday needs, but also be able to make the case of why it actually makes more sense to have people out. And that can be a relationship that goes back and forth together so that we don't have to see it as service provision on one side and advocacy on another, but actually that there's a way of coordinating those efforts. And I do think it's just a moment where if you have the money, if you have the resources, you can spend them on getting people out. Because I also think part of the second wave of this fight is going to be insisting on keeping the numbers low and showing that we don't have to incarcerate people. So it is in everyone's best interest to be able to get as many people out as we can.
Thank you, Jacinta. We have time for one. We have 2 minutes. We have one last question. We have a couple more questions, but we just have time for one more. And this is, I think, a really, really, really important question. So my state, like all states, have stay-at-home orders. How can our organization do direct actions? I'm scared that I'm going to get arrested. How are we supposed to do direct actions with stay-at-home orders? Who would like to answer this question?
This is, sorry, Thomas. I think this is a very important question and going to be more increasingly important as the pandemic continues. There are going to be major efforts by the state to control even further than normal the ability for people to speak out. I think that there are, right now our project is looking over all of the executive orders and emergency declarations to determine what kind of powers have been conferred to states and sheriffs to arrest people in this. I think it's very frightening, and I think we ought to have another webinar to discuss exactly that question. I think for now, what people have been doing is doing creative protests where they get in their cars and do a honkathon or do things where so that they're allowed to be outside, or they do a social distancing protest. But I think this is an incredibly important question, and it touches on what we can all anticipate is going to be a major opportunity for the state to crack down on people and surveil people even more. And we ought to do this again and talk about those implications.
Thank you, Thomas. I really want to thank all the participants today. I just want to highlight who they are again. You heard these are the Twitter handles, and these are our speakers. You will be getting this brief PowerPoint. Thank you everybody for listening, for being part of this webinar. I thank you everybody who participated and asked questions. And again, if you wanted to tweet about what you learned or your outrage about what's happening, use the hashtag #FreeThemAll. And these are some resources we'll be linking people to, and we will be providing the template that Advancement Project created. Again, I want to thank you all for participating in this webinar. It is being recorded. We will have it on our website. We will have the template on the website and a link to resources on our website. I hope you have a good rest of your day and be safe, and hashtag #FreeThemAll, free our loved ones, abolish all cages. Thank you so much for joining us, and we continue the fight. I think we're probably going to have more webinars in the series, because I believe there's going to be a more need that we need to talk about surveillance, and as we're seeing this, because this isn't going to go away. I'm just really excited to be part of this, and I wish you the best in your endeavors today. Thank you all. Bye, everybody.